Hello, my name is Jason Redwine. I'm an orthopedic nurse practitioner. I've been in orthopedics for about 8 years. Prior to that, I was a chiropractor for about 12 years. Altogether, I'm almost coming up on 9 years of orthopedic nurse practitioner. So altogether, it's been about 20 to 21 years of experience in musculoskeletal problems. Having a reaction video to a video that was put out by Wired with Dr. Andrea Love regarding pseudoscience. Now, I'm not going to play the whole clip. I want to play the beginning where she introduces herself as well as the video, and then a specific question that I have a little bit of difference of opinion on, and some things that I think she got wrong. So let's go ahead and look at the clip.
I'm Dr. Andrea Love, biomedical scientist. I fact-check false health claims. This is Pseudoscience Support. Away from the Keys wants to know, how do you define pseudoscience? So pseudoscience refers to beliefs or practices that appear scientific on the surface, but they lack the repeatability, the reliability, or the credibility of science. Often they're making claims that are based on anecdotes as opposed to evidence. They often start with a nugget of truth and then widely exaggerate that beyond what reality would indicate. It's Synecdoche is asking, why am I only just learning that chiropractors are not real doctors? Yeah. So chiropractic is a $15 billion industry, and it was invented by a guy named D.D. Palmer who thought that ghosts were telling him to create it. They believe that the joints and the nerves that go through our body are the cause of every ailment that we know of. Unfortunately, chiropractic is a full-on pseudoscience. There are certain chiropractors that maybe stay in the lane of more physical therapy, and there's a little bit of data to suggest that for certain types of low back pain, chiropractic adjustment can offer temporary relief, but it's not fixing a musculoskeletal problem, and it's definitely not doing the other things that chiropractors claim to do. So if you see the abbreviation DC after someone's name on social media, that means that they're a chiropractor and they're not a medical or scientific expert.
Okay, wow. So I have to say, I watched this video a few days ago, and it did trigger me a bit then. And watching it again, I'm definitely triggered again. Like I said earlier, I was a practicing chiropractor for 12 years, and I didn't stop because I don't believe in it, because I do believe that chiropractic is very helpful. I stopped and moved into orthopedic nurse practitioner because I wanted to help people in a new way and experience a new challenge in my life. And quite frankly, I enjoy what I do. So I think it's important, given the nature of the question of, basically, I feel like the question is, what's a real doctor? Because the question said I was not aware that chiropractors are not real doctors. And then Dr. Love, read the question pretty sarcastically. And so I feel like it's important to understand her credentials as well. And so when I saw the video and it said medical scientist, I never heard that term before. And so I thought, well, is that a medical doctor also? And I looked up medical scientists, and surely there are medical scientists that have medical doctor degrees. However, when I look up her credentials, it did take me a little while to find exactly what her credentials are, but it appears that her degree is a PhD, which is not a medical doctor either. And as I further dug, it seems like her specialty is immunology and microbiology. So it appears that she does research, probably on pharmaceuticals, but not sure. There was some research articles that I saw on immunology, but needless to say, it doesn't appear that her specialty is musculoskeletal problems. And I do feel like this is important. I can tell you, throughout my career, I have noticed problems from other providers missing things when it comes to musculoskeletal disorders. And I think that's pretty common. We have significant amount of specialties when it comes to the healthcare industry. And it's for a good purpose. You wouldn't want to go see your cardiologist for, say, a musculoskeletal problem. I'm not saying that they don't know some things about musculoskeletal, but you would want to go to a musculoskeletal provider, such as an orthopedic, chiropractor, physical therapist, maybe even a neurologist or neurosurgeon. All of these people have extensive knowledge in musculoskeletal and nerve type problems. But you wouldn't necessarily go to, say, an infectious disease doctor for that kind of problem, nor would you want your orthopedic surgeon to treat you for a systemic infection. You would want to go to an infectious disease doctor. So specialty is important, credentials are important. Equally, while I do know some things about immunology and microbiology, and I do treat people with antibiotics, I wouldn't say that that's my specialty, and I wouldn't appear to comment on especially research when it comes to new and upcoming medications related to immunology, microbiology, and I would defer to her maybe on that type of subject. So I do feel like credentials are important. I found it a little odd that she didn't just come out and say that she was a PhD doctor, especially commenting on a video, or I'm sorry, a question asking about what a real doctor is. So with that in mind, let's talk about what a real doctor is. I think it's implied that a real doctor is a medical doctor. And well, that's just not really the truth. Even within the medical field, there are doctors that have medical degrees, but there's a lot of primary care doctors that have a degree in osteopathy, which are called DO. So, and not a medical doctor, MD, doctor of osteopathy, DO. And nowadays, the two have become pretty similar, but osteopathic medicine originated with a manipulative type therapy similar to chiropractic. So even today, there are osteopathic manipulative therapy, and just like there's chiropractic manipulative therapy. But osteopaths are, in most of our healthcare, you can be an osteopathic surgeon, you can be an osteopathic primary care doctor or family doctor, just about any specialty, just like a medical doctor can be. But according to this definition, an osteopath might not be a real doctor either, and we know that's not true. So then you can go on further and say, well, is a dentist a doctor? And they are. Again, not a medical doctor, but they still are a doctor. Would a podiatrist be a doctor? And yes, they are. They're just not a medical doctor. They're a doctor of podiatry. So there are many examples. Optometrists, also doctors, not medical doctors. So to say that somebody is not a real doctor because they're not a medical doctor, I think that we can all agree that that's not really true. It's a common misconception, and it is important to realize what kind of provider you're seeing. But medical doctor is not synonymous with real doctor. We're all doctors. And just like I would argue that Dr. Love is a doctor, even though she's not a healthcare provider because she's a PhD, she's a doctor. I would also argue that maybe a PhD non-provider doctor shouldn't be giving advice on what a healthcare provider is. Okay, so what I'd like to do now is just listen to a couple of clips of the video again and just kind of break it down step by step. So let's look at this small clip real quick.
And it was invented by a guy named D.D. Palmer who thought that ghosts were telling him to create it.
And so, again, I feel like this is almost kind of a fear tactic. She's saying that chiropractic was invented off of the advice of a ghost. And so, I didn't mention this earlier, but I was actually trained at Palmer College, which is the founding college, which is related to D.D. Palmer. And during my time there, that is not how I heard chiropractic was founded. The first chiropractic adjustment was given to somebody that was deaf. And the story that I heard while I was there is that this person was a cleaning man in the building that Dr. Palmer worked at. And The person was deaf, and they became friends. He knew each other's family, and Dr. Palmer noticed one day that the person had a bump on his back. There's some debate, maybe that it might have been the neck. And Dr. Palmer pushed on this area, created a pop, and the person began to hear again. Now, I don't know how accurate that is. I can tell you that throughout my career, I've never had any impact on hearing. In this part of the video, I'm not trying to debate what chiropractic can and cannot do. We'll get to that in a few minutes. But I think bringing up that chiropractic was founded based off of ghosts telling him to do it is nonsense, for one. For two, there's a lot of professions and really some thoughts that start based off of some kind of inspiration. So I guess you could say maybe D.D. Palmer was inspired in some way, and I would probably agree with that. Similar to other fields, there was a time in our history when we didn't believe that the world was round. I guess some people still debate that, but we also believed that everything revolved around the earth, that the sun revolved around the earth, and we know that that's not true anymore. And it took an inspirational person to go against what the common knowledge was and be called names and be threatened with death to change those views. And so that's kind of what I would say, is that people are inspired all the time and new ideas come up, and history can be proven true, it can be proven false, and I would argue that in this case, chiropractic has a good history that has been true, that it helps in the ways that it helps. And we'll get onto that in just a few minutes, because she talks about how chiropractic is not helpful. So we'll circle back to that. I do think it's important that her tone in this is obviously, for lack of a better word, not very favorable. I think maybe that's probably the best way, is that she obviously has a bias here, and not very favorable. So the next clip I want to look at, let's go ahead and start that.
They believe that the joints and the nerves that go through our body are the cause of every ailment that we know of. Unfortunately, chiropractic is a full-on pseudoscience.
Okay, and so she says basically that chiropractic is a full-on pseudoscience, which obviously I'm going to disagree with. Later in the video, she points that there's a little bit of evidence, what she says, a little bit of evidence that chiropractic helps with low back pain. So the reality is that there is quite a bit of evidence that chiropractic helps in more than just low back pain. Chiropractic has been recognized as a healthcare profession in all 50 states. It's regulated by a state board in all 50 states. Chiropractors have to obtain a license by the healthcare department in all 50 states. Now, beyond that, chiropractic is recognized worldwide. There are many countries that recognize chiropractors as physicians, including some that we know, like Canada, Great Britain or England, Australia, I believe, does as well. And there's many more. Those are the ones I know off the top of my head. More than that, though, we know that chiropractic can be very helpful with musculoskeletal problems. In fact, recently, I believe it was in 2017, chiropractic was was recommended as a first-line treatment for neck and back problems by the American College of Physicians. So they specifically say that chiropractic manipulation should be recommended as first-line treatment before narcotics, before surgery, before other advanced interventions such as injections also. It does mention that physical therapy would be recommended as first line, as well as acupuncture. But the point is that chiropractic has been recognized as helpful with spinal problems. Other places such as Harvard have come out and said that they recommend chiropractic for neck and back problems as well as headaches. I found an article that Duke also recommends chiropractic for neck and back problems. So these are not, obscure places. These are well-recognized places, well-respected places that are recognizing chiropractic as beneficial in the healthcare marketplace. And in reality, it makes a lot of sense because here's the thing. Should narcotics be first line? I think most people would argue no. We recognize that there are many problems with narcotics. And then I can tell you with my history in orthopedics and primarily in spine, most of my orthopedic career has been in spine. And I can tell you that most surgeons will tell you that a very small percentage of the population are actually candidates for surgery, that there's a large population of people that have spine problems. And out of that population, maybe 1% of those people actually have a problem that would benefit from some type of spinal surgery. Now, that's still a lot of people that get spine surgery, but when you compare it to the overall number of people that get spine or that have spine problems, it's a very small percentage. So let's go on to the next clip and just kind of see where she's going next.
There are certain chiropractors that maybe stay in the lane of more physical therapy, and there's a little bit of data to suggest that for certain types of low back pain, chiropractic adjustment can offer temporary relief, but it's not fixing a musculoskeletal problem, and it's definitely not doing the other things that chiropractors claim to do.
So she finally states that there is a small amount of research that chiropractic can help with for low back pain. And we kind of went through this just a minute ago. Chiropractic helps with more than just low back pain. I have a little bit of an issue with the way that she phrases this. She says that it can help with chiropractic, but then she says it certainly cannot help with all the things that it has claimed. So I'm not disputing. There are people out there that claim that chiropractic can help with a wide array of things. I can tell you that the research shows that chiropractic helps with musculoskeletal disorders. One thing she mentions is that it certainly doesn't change anything or fix anything. And so I think that's an interesting word to use because I would argue when it comes to musculoskeletal problems, there really isn't a fix. And so let me explain what I mean by that. So let's say you have arthritis. We don't really have a good treatment for arthritis. Right now, when it comes to arthritic type problems, whether it's in the knees, the hips, or the spine, and let's kind of focus on the spine for a minute because that's where chiropractors kind of hang their hat. So when it comes to spine arthritis, the most common way that we describe that in the medical field is degenerative disc disease, which is basically a subset of arthritis, of osteoarthritis. And there is not really a way to undo arthritis, okay? If you go to physical therapy, the physical therapist is not fixing your arthritis. A chiropractor is not fixing your arthritis. If you go to an interventional pain doctor, they're also not going to fix your arthritis. Now, the last step that most people take is surgery. And so you could argue that a surgeon changes the arthritis because they'll remove bone spurs and, discs that might be associated with that arthritis. But is it a fix? And I would say that, in my opinion, it's not. And I think the surgeons that I've worked with would also say that. that we're not necessarily fixing the problem, but what we are doing is helping with the symptoms. And I would say that everything I just mentioned, whether it's chiropractic, physical therapy, interventional pain, or surgery, have the potential to help with the pain associated with osteoarthritis or degenerative disc disease. And that level of help really depends on the individual. But I don't know many providers that would say, hey, you have degenerative disc disease, go get surgery as your first treatment. In fact, we know that it's not recommended as a first-line treatment, but chiropractic is, and for good reason. Typically, when it comes to musculoskeletal problems, we try and treat them on a basis from least invasive, only going to more invasive type treatments when people are not responding. And most guidelines when it comes to this say you should try physical therapy, chiropractic, like I said, acupuncture is listed also first. And the vast majority of people, while it won't quote unquote fix their problem, it can definitely reduce their symptoms and get them back to a more normal daily life. Okay. Now, but I gotta say too, every surgeon I've worked with, and I've worked with quite a bit, never say that they're going to fix someone's back problem. Most of them say, I'm not even going to get rid of all of your pain. Most of them will say, I can reduce your pain, but you'll still have some pain. And that's kind of the case. So when it comes to chiropractic, I can tell you throughout my career, I have gotten people to no pain. It may not last forever because nothing lasts forever. You can say in healthcare in general, what have we actually fixed? I struggle to think of something that has been fixed in healthcare. I think that there is quite a bit wrong with our healthcare, and maybe that's one of them. But I think the people that argue against me in that regard would say, okay, well, we do pretty good with a few things. Say high blood pressure. We're pretty good at managing high blood pressure with different medications, but none of them fix it. You're required to take the medication for the rest of your life. If it was fixed, you would be able to stop taking the medicine at some point, right? Maybe the one thing that I can think of that we're really good at fixing, at least temporarily, would be infections. And, Dr. Love would probably be better to go down this pathway, but with infections, we have antibiotics that are really good at killing most bacteria, but even there, we're running into resistances, and a lot of the antibiotics that we used to use, we don't use as much, or we have some infections that don't respond to any antibiotics now. So in healthcare, I think fix is probably a very poor term to use when it comes to, is a patient going to be fixed? No. Okay. That's a very poor term. Some things can be improved upon, but you can even go back to the infection. If you take an antibiotic, that doesn't mean you're never going to get an infection again. It can get rid of the infection you currently have, but you still may get another infection at some point. So did it fix that problem? I don't know. I think it's a very vague term. And I think almost everybody in musculoskeletal would be hesitant to say that they fix anything, not just chiropractors. But I think all of us would say that, yes, we do improve people's quality of life and reduce pain. One more thing I kind of want to get into with the research that she mentioned. So chiropractic, in terms of professions, is relatively young. Chiropractic is only a little over 100 years old. To put that in perspective, let's go with her profession. She's a virologist and a microbiologist. And, the current theory that we work under with bacteria and antibiotics is something called the germ theory. And so when we talk about germ theory, initially that was something that was thought of as not right. A lot of people pushed back against it. And the people that believed in germ theory were told that they were a pseudoscience. And if we look at their history, microorganisms were first discovered somewhere in the 1600s, and same thing in the 1600s, they were starting to see it in blood and other things within the human body, and that's when germ theory was kind of starting to be tossed around as a possible reason for infection. Germ theory was not adopted until the 1900s. So we're talking 200 to 300 years that it took for the science community to accept that bacteria were the cause of infection, or that viruses were the cause of infection. And so I find it really hard to justify what she said, that there's little research, when in fact there's a lot of good research showing that chiropractic helps. And we were able to do that in, around 100 years, versus a very common thing that we know to be true now was harshly criticized for 200 years plus, and only recently been accepted in the 1900s. So maybe the last 100 years or less has been accepted. Took 200 years of research to actually adopt and show to be true. So it's a little hypocritical that she would think that something like her field of microorganisms is superior when it took them significantly longer to prove a very basic concept. Chiropractic has lots of good research, like I said, for neck, back, and headaches. And this has been recommended not just within the chiropractic community, but within the medical community as well. Let's go ahead and look at the last bit of the clip.
So if you see the abbreviation DC after someone's name on social media, that means that they're a chiropractor and they're not a medical or scientific expert.
Okay, and so here she says that a chiropractor is not a medical expert. Okay, so I had to look this one up also, because the intention is that with medical expert, you would think that that means medical doctor only, right? But again, we know this is not necessarily true. And I can say within my own career as a chiropractor, I have testified as a healthcare expert or a medical expert. I've been deposed as a healthcare expert. And really, the definition for a medical expert is just, let me read it to you real quick. A medical expert is a professional with extensive knowledge in a particular area of medicine who provides expert opinions and evidence in legal proceedings. And like I said, I've been deposed in legal proceedings as a medical expert. So another definition is a professional who relies on and cites published medical research to provide accurate information and make informed decisions in the field of healthcare. So, this definition doesn't even really specify that it has to be any kind of provider. It just says a professional. So I guess in that regard, she could be considered a medical expert since she does medical research. But certainly a chiropractor would be considered that also. When I listened to her video, she makes it sound like only a medical provider can be a medical expert, and that's just not true. We have lots of healthcare providers that are considered experts and testify in that regard. I would argue that my experience as a provider gives me more expertise in treating patients than her experience as a scientist, researcher that has never provided any kind of care to a patient. So, again, this is probably longer than what I wanted it to be, but there is quite a bit here that I felt like needed to be unpacked. I hope you guys like the video. This is a first time thing for me. I saw her video and I just felt like I had to respond. And so I wanted to put this out here. I have quite a bit of knowledge in healthcare. Like I said, over 20 to 21 years. I have a lot of opinion on our healthcare in general in the United States, as well as how it's dispersed. The healthcare in general, I feel like we need to revamp healthcare in this country from top to bottom, from how we do it to how things are approved to cost. And so these are things that I might be willing to talk about in future videos, but let's see how this one does and how the feedback is. And if you guys have things that you would like me to go over or talk about, please do leave a comment. Show me that you're enjoying this, and I'm happy to provide more information in the future.